We begin this morning with a sobering reality check. Despite marginal improvements in recent years, millions of South African children remain locked in a cycle of deprivation that goes far beyond income. New data from Stats SA shows that nearly 12 million children here in South Africa are still living in what is termed multidimensional poverty, a measure that captures not just financial hardship, but lack of access to basic services like education, healthcare, adequate housing, and nutrition. And while there's been a slight decline in the numbers, experts warn the pace of change is far too slow, and this is raising serious concerns about long-term inequality and just the future prospects of an entire generation. 12 million young South Africans, you can only imagine. And to help us unpack what's driving these figures and what they mean in real term, we're joined by Acting Deputy Director General for Population and Social Stats at Stats SA, Mr. Soli Molayi. Mr. Soli, thank you so much for joining us. Welcome to News and Views. I really appreciate you giving us your time.
Good morning and good morning to the listeners.
And I think we'll jump right into it. We'll start with the basics. When we talk about multidimensional poverty, what exactly does that mean in the South African context, and how is it measured, and how is it different to standard poverty, how we know and understand it to be?
Thank you so much. So in South Africa, we measure poverty in three ways. The first one is what we call it the money matrix poverty. This is where looking at the money, or let me put it this way, income and the consumptions that are happening within the household. If you read our National Development Plan, we do have what we call it the poverty lines. And these poverty lines are able to tell us whether individuals are either food poor in terms of their food poverty line, or they are at the level where we call it a lower bound poverty line. And the last one is the upper bound. So that is the first measure. The second one is what we call it a subjective poverty measure, where households themselves, they will indicate whether in the scale between poor and not poor, where they rate themselves. And that is why we call it the subjective poverty measure. The third one is the one that we released recently, which is what we call it a multidimensional poverty measure. Basically, what it's saying is that instead of looking at one factor, you're looking at the multiple factors in terms of poverty, because poverty is quite a complex phenomenon to actually measure. Hence, the multidimensional measure is one of the measures that we're using to able to unpack it. So in this case, we have about 7 dimensions, and we're talking about nutrition, health, the issues around education, protection of the safety, and then the issues around service delivery, including access to information. And we dedicated this report to our young ones between 0 and 17.
And I think that's very, very concerning. I want to jump right into the figure itself. Nearly 12 million children. That's a really staggering figure. Can you give us a sense of how this compares to previous years? Are we seeing meaningful progress or just marginal shifts? 12 million. That's a lot.
Thank you so much. So the report is doing what we call it a comparison with the previous data point, which is 2015. And at that point in 2015, the number of children was sitting around 18.8 million. Currently, we're sitting around 20.4 million. So in 2015, we were sitting about 11 point, let's run it up to 11.4 million children. And that is were classified as multidimensional poor. And to your point, now we are sitting at about 11.5 to run it off. And I think the news article that you're referring to, we just run it off to 12 million. In proportions to the total, that's when we're seeing that 57.2%, which is the 3% difference. So the change, as some of the experts are saying, comparing the two data points, one would be able to say probably the change is quite slow. But I think we have to put it in context in terms of the number of children in South Africa that are increasing over time. But at the same time, we are also experiencing a different type of multidimensional poverty for the young ones. And currently, it's clear that it's driven by issues of service delivery, not just for the household, but also the issues of the school facilities, where we find that those school facilities, they don't have water, or even
mm.
access to sanitation.
And that was coming to my next question. What are some of the key drivers behind this kind of poverty, especially amongst children, as you specified, and you mentioned service delivery being amongst them? Are there other structural issues like unemployment, issues like inequality, that also add into where we currently find ourselves?
Yes, issues of unemployment is part of the broader discussions that we're also seeing in other indicators. But I think specifically for this one could see that 0 to 17 as a group of children, it's always important to break it down in terms of stages, because we know that the children between 0 and 4, these are the young ones who are still at the eligibility centers, and their poverty or the drivers for multidimensional is quite different to those between 5 to 12 or 13 to 11 to 17. So let's start with the 0 to 4. We're seeing that issues of health, which is nutrition, because these are the young ones, they are still trying to develop, and then the health issues become a driver in terms of access to the health facilities, and also having a what we call the road to health card. This is the card that is quite important for a young one to be able to tell the history of development, especially in community. And then the second driver for these young ones is issues around service delivery, which I
Mm-hmm.
really mentioned is key. Then you go to the 5 to 12, which is the biggest age cohort in the children age between 0 and 17. These are the primary school age children. And then issues of education, which is your facilities that the young ones, especially the primary school, issues of service delivery. And then you see now issues of health coming in, and also the quality of houses that they stay in. Because remember, children are also coming from the communities, and they are also part of the community. So they are also experiencing issues around service delivery and issues around that. Then those who are in the 13 to 17, these are those who say adolescent age, issues around education, and again, it's similarly to the primary schools where we're talking about the facilities. So all of this, it tells us that our young ones, they are still experiencing this multidimensional poverty, but the core driver that is cutting across all these ages is issues of service delivery, education, and health. Those are the three big drivers.
Very, very concerning. And I want to take a look at some specifics. Provinces or communities that are most affected. Are there clear geographical patterns that are emerging from the data that you guys have collected?
Definitely. So we're seeing that in the recent data point, we see the highest provincial differences between those provinces that we classify as rural provinces. So Eastern Cape is leading, and also Limpopo and KZN. And this is where the children are actually experiencing more of the multidimensional poverty. Their poverty rate is quite high. Gauteng and Western Cape, you're seeing the lowest sitting around 35% to 36%. And these are the two economic hubs. And again,
Mm,
if you look at the previous multi-matrix poverty report, which looked at the income, we're seeing the similar patterns where your Eastern Cape, Limpopo, and KZN, they are the ones who are actually also experiencing what we call the food poverty measure. And it's not surprising that we are seeing it in multiple areas. Similarly, also, when you look at it with the other reports that talks to unemployment in those particular provinces, we are also seeing the similar picture. So Eastern Cape, Limpopo, and KZN, service delivery challenges coming from the general council survey is saying the same. So it's not surprising that the report is also, in a way, painting the same picture that we have seen in other reports.
mm, mm, mm. From government's perspective, because I'm sitting here thinking to myself, Stats SA obviously does present these figures to the government, and they would try and have some preventative measures or some corrective measures in place. Are the current government interventions, the ones that we know, the social grants, the free education programs, the nutrition schemes that they have in public schools, making any kind of measurable difference when you look at the data and how over the years it has evolved and changed?
Certainly, if you look at let's start with the social grant. If you look at social grant, the impact of social grant in the household, over the years, we've seen that the recipients of social grant, they've increased over time. But then in the analysis that we've done in the money matrix poverty report, where we are looking at the income that is coming into the household, social grant is an income that's actually a safety net for a household. We've seen that in South Africa, about 10.8 million people are classified as food poor. And if you take out the income or the social grant as an income in the household, that number doubles to about 50 million. So a grant or a social grant, it is a safety net for most of the household, and you've seen. And in terms of the feeding scheme, the one that you've mentioned for our young ones in schools, we've seen how it actually has also increased over time, and it's actually assisting the young ones to be able to have something. Because in the report that we were talking about here, the issues of food security, which is the challenge that the young ones are also experiencing. And we've seen in the report that we have also around food security in South Africa that households are also experiencing. At some point, they are saying that they are also struggling to put food on the table. And this has to do with the number of individuals that are in the household that are not working. And also, as you look at the income and expenditure within the household, you can tell that the households are at the pressures. They have a lot of pressures in terms of fooding, and the prices also from the CPI side are showing us that the cost of living is quite expensive, and even the prices are also increasing. So it is clear that some of these social programs that government are putting on the table, they do assist in terms of ensuring that there's a safety net for our young ones. But as I said, that South Africa population, it's actually driven by the number of things that are born in a year. And the more they are coming in, and the more we are not dealing with the issues of service environment, I think these numbers won't be able to change in the near future, unless if we are able to deal with the issues of service environment and ensuring that the young ones, especially at school level, they are able to have those facilities that are good.
That's very, very important to note. And my other question now, I think it's a very, very important one, because there's often a concern about the long-term impact of something like this. What does growing up in multidimensional poverty mean for a child's future in terms of their education, the employment prospects in the future, health outcomes, and how they turn out as an adult? Do they grow up to be adults that are functioning and that are able to contribute to society, or it's a beginning of a downward slope for the rest of their lives from there?
I think my colleagues who are in the will be probably in a better place to articulate it. But I think from the data perspective, looking at the National Development Plan, it's actually giving us a direction, which is saying by 2030 we need to reduce poverty to a zero. So we are sitting, as I said, food poverty is sitting about 10%.
That's 4 years from now.
Yes, that's 4 years from now. So it means that there's quite a number of work that is need to be done. All of us, business, service society, including us as statisticians, in terms of ensuring that we are able to update these indicators as we are moving towards 2030, so that we'll be able to see the progress, and we're going to have a sober discussion in terms of what went wrong, what are some of the challenges. And at the same time, this period also, we need to also be aware that as a country and as a world, we also experienced what we call the COVID in 2020, which was the middle or the middle or the half mark of the 2030 period of the NDP. So that impact on some of these indicators, we have to put that into perspective when we are discussing this, because if you look at unemployment numbers, at that point in 2030, one, we were hoping that the numbers of those who are working, it would have increased, but the COVID came, and then we had to restart these processes where we are now recovering, and we're seeing a little bit of improvement, where we are now still sitting at about almost 34% unemployment rate. And then the young ones, especially the youth, and those with mentioned, their unemployment rate is quite high. So these young ones who are experiencing multidimensional poverty now, assuming that the picture doesn't change, it means that when we get into a secondary education and they get outside the secondary education, they will be having a challenge in terms of getting into the higher education, including also getting work, because of we have seen from the numbers that those who mentioned, their unemployment rate is quite high.
There we go, Mr. Molayi from Stats SA. Thank you so much for, I think, painting that very, very bleak picture. But I think it's important that South Africans know about the state of affairs of our country. And this one is a very, very concerning one. Hope we chat again soon. Really appreciate it.
Thank you.
There we go. Yeah, I think very concerning turn of events there. So Molayi from Stats SA painting a very, very bleak picture. Almost 12 million young South Africans caught up in multidimensional poverty. And that's not poverty because someone's not working, but it's multidimensional. It means it goes as far as the kind of education they receive. It goes as far as the service delivery in the communities that they're living in. And just generally, holistically, their lives do not reflect, I think, what we thought South Africa would be 30 plus years after democracy. And I think it's a reminder that while this data may show slight improvements, the scale of deprivation remains deeply, deeply concerning. And you see it. You see it every day, man. You see it, mothers with their children on the side of the roads begging. You see it, children dying and drowning in pit toilets, and it's there. It's clear for everyone to see, and I think all of us need to be concerned because these are not just numbers. These are human beings. This is the future of South Africa, and you have a whole generation, 12 million of it, growing up in multidimensional poverty. And I think stats will tell you that the majority of those that grow up in these kind of circumstances, unfortunately, when they grow up, they don't become fully fledged, fully functional adults that are contributing to society. So yeah, really concerning. Not how I thought we'll start our morning, but very, very sobering conversation to have. We're going to take a quick break. When we come back, it's time for our hashtag Africa Focus feature.
Rejuvenate